When we're learning anatomy and physiology, we have to learn a lot of new language. The language that we use is very precise, and it's also somewhat complex. But it's important that we know this language because it helps us communicate with one another about the human body. The type of language I'm talking about is the language that allows us to describe the location of various structures relative to one another and relative to the environment. This type of language allows us to divide the body along different planes, and it also helps us describe cavities that exist within the body. Unfortunately, about 90% of the terminology that we use to describe this anatomical and physiological language is Greek and Latin. And so it's a little bit difficult to get accustomed to. It takes some practice. Before we start talking about this terminology, we have to have an understanding of what's called anatomical positioning. And that's what you're looking at on this slide. Whenever we use the directional terms of anatomy and physiology, we imagine a human with proper anatomical positioning. Now, what do I mean by that? It means that the person is standing upright, facing the observer, facing the person that's doing the describing. Their head is level and their eyes are facing forward. That means that the person, the subject's left side, is going to be to the observer's right side. And the subject's right side is going to be toward the observer's left side. The feet are flat on the floor, and the toes will be directed forward. The arms are going to be down at the sides, straight, and the palms of the hands are going to be turned forward. This is important to remember because sometimes when we imagine a person standing in front of us, we imagine that their palms are either facing towards their legs or even towards the back of the body. But when we're using anatomical terminology, we assume that the palms are facing forward. Now you can see some of the terms that we'll be using in anatomy and physiology written on this slide. You can see terms like superior and inferior and proximal and distal. These are the kinds of terms that we're going to be learning how to use correctly. We're going to go through them today, but understand that you'll gain practice with these terms all semester long, particularly in the laboratory portion of the course. So we'll begin with directional terminology. Remember, these are the kinds of terms you use when you want to describe a structure on or in the body in relation to another part of the body. These terms are usually paired. For example, on this slide, we're looking at two terms, superior and inferior. The term superior refers to toward the head or toward the upper part of a structure. Now you'll notice there's a second term, cranial. Superior and cranial mean the same thing. And depending on the source material that you're reading, you can see one or both of these terms used. Interestingly enough, superior is the preferred term in human medicine, while cranial is the preferred term in veterinary medicine. So toward the head or toward the upper part of the structure. Now compare that with inferior, and a similar term is caudal. These terms refer to away from the head or toward the lower part of the structure. As an example, we could say that the thoracic cavity is superior to the abdominal cavity. The next pair of terms is anterior and posterior. And once again, we have secondary terms for each one. Anterior and ventral mean the same thing. Posterior and dorsal mean the same thing. When you describe something as being anterior, you're saying that it is nearer to or at the front of the body. In comparison, posterior means nearer to or at the back of the body. So if you look at the image on this slide, we're looking at a human skeleton, and the skull is facing off towards the left. We can describe, for example, the sternum as being on the anterior surface of the rib cage. We can describe the vertebral column as being on the posterior surface of the body. You might also hear the human patella being described as being located on the ventral surface of the knee, and maybe the gastrocnemius muscle, which is not shown in this drawing, that would be found on the dorsal side of the leg. You've probably heard of dorsal fins on certain marine mammals. Again, ventral and dorsal are the preferred terms in veterinary medicine. Anterior and posterior are preferred in human medicine. The next pair of terms is medial and lateral. To understand these terms, we have to understand that when the human body is facing us, we could draw a line right down the center of that body, dividing it into equal mirror images, equal halves. When you use the word medial, you're describing something being nearer to that midline. We're going to describe that midline in a moment as a plane, and we refer to it as the mid-sagittal plane down through the center of the body. So medial means toward that plane, that midline or mid-sagittal plane. The term lateral then refers to away from the midline or sagittal plane. Down at the bottom of the slide, you're looking at a couple images of legs, and you're seeing an indication that the legs are twisting, they're turning, if you look at the feet in particular. So when the foot is facing forward in, again, the correct anatomical positioning, if the toes move medially, they are heading towards the midline. If the toes move laterally, they're moving away from the midline of the body. The next pair of terms are proximal and distal. Proximal refers to nearer to the attachment point of a limb on the trunk, or nearer to the point of origin of a structure. In comparison, the term distal refers to being farther away from the attachment of a limb to the trunk, farther away from the point of origin. So if you look at the diagram over on the right-hand side of the slide, you can see the arrows representing proximal and distal. So if we're referring to structures on the arm, for example, you could say that the shoulder joint is proximal to the elbow joint, for example. Or you could say that the hip is proximal to the knee. You could turn that around and say that the knee is distal to the hip. You can see on the lower drawing actual photograph of someone's legs, and there are dots drawn all the way up the leg. You can describe any one of these points in relation to any other point as being proximal or distal to each other. So you would say that this point is proximal to this point because this first point is closer to the point of attachment, or closer to where the leg attaches to the trunk of the body, and this point is farther away. So we use proximal and distal when we're comparing, again, two structures, often on one of the limbs. So those are our directional terms. We're going to switch gears now and talk about planes and sections. I mentioned the mid-sagittal plane a couple of minutes ago as being that plane that comes down right through the center of the human body when the body is facing you, and divides it into equal left and right halves. So the sagittal plane is a vertical plane that divides the body into right and left. Mid-sagittal divides it into equal right and left, halves, in other words. Parasagittal divides it into unequal. So if you look at the drawing over on the right-hand side, they're showing you a sagittal plane through this body. This happens to be the mid-sagittal plane. It's the plane that would be created if you divided this body right down the middle into equal left and right sides. But if you can imagine, you could move this plane over slightly to the left. You could move it over to the right. You would still be creating a sagittal plane, but it would no longer create equal halves. It would create unequal left and right. So moving it away from the central mid-sagittal plane creates what we call parasagittal planes. Now you can also bring a plane down through the human body, but instead of it dividing into left and right halves, it would divide into front and back, or remember what we would call now anterior and posterior halves. The frontal plane also goes by the name coronal plane. And again, it's dividing the body into anterior and posterior portions. I do want to note here that anytime you use any of these planes, these descriptive planes, you don't have to be discussing the entirety of the human body. You can also divide any structure within the body using these planes. An organ, for example, can be described having a frontal plane through it and creating both an anterior portion and a posterior portion. The next plane is called the transverse plane. This is a plane that cuts through the body horizontally. So it's dividing the body into what you might consider upper and lower portions, or what we could now call superior and inferior portions. Horizontal planes can cut through the body this way at any level. In other words, we're not talking about it creating equal portions of the body. That wouldn't be possible, right? Because there's no symmetry between the superior and the inferior portions of the body. So any plane that cuts horizontally through the body would be a transverse plane. On this slide, you're looking at those three planes that we've talked about so far, all being combined in the same image. So we can see a sagittal plane that's cutting the body into left and right. This happens to be a mid-sagittal plane. We can see a frontal plane or a coronal plane, cutting the body into anterior and posterior portions. And we've got a transverse plane, cutting the body horizontally and creating superior and inferior portions.